Extreme weather and flooding. Cases of extreme weather mostly appear as high rainfall, strong winds and floods whose impacts are mostly caused by environmental and infrastructure damage. During strong winds such as hurricanes and typhoons, access to safe water sources is reduced. Access to services, including health services, may also be disrupted. For pregnant women, extreme weather creates various difficulties and fears such as fear of losing their home, job, access to various services, fear of the baby's health and the birth process. Strong winds the size of Hurricane Katrina in the United States left post-traumatic stress disorders at a higher rate in pregnant women. Such storms also increase emergency visits due to pregnancy complications. Those who experience hurricanes are at risk of pregnancy complications, premature birth, low birth weight, birth by cesarean section, and abnormal baby conditions. The presence of hurricanes with their various consequences also reduces pregnancy checkup visits. In areas that frequently experience hurricanes, there are more cases of premature birth, low birth weight, fetal death, and fetal distress. Floods also have an impact on pregnancy. The floods in Thailand in 2010 caused a decrease in birth weight by almost 3 times compared to previous conditions. In the same year in Pakistan, floods caused severe obstetric problems, including abruptio placentae and premature rupture of membranes. This problem is more severe in areas that before the disaster already had quite serious problems. Research in China in 2006 to look at the impact of the Yangtze River flood found that 8 years after the flood there was a 5% increase in cases of intelligence disorders in children. Pregnant women affected by flooding double their risk of intelligence disorders. The risk is high when pregnancy is in the first semester with a 5-fold risk. The risk of intelligence disorders also increases with the length and severity of the flood experienced. Those who experience flooding for 3 months had the greatest risk, up to 5 times higher. Children have a high risk of death during floods. Floods can cause malnutrition due to food shortages, crop failure, and unsafe food stocks. Young children have a higher risk of drowning than older ones. 75% of deaths are caused by drowning. Toddlers have the highest risk of being affected by flooding worldwide. The Sri Lankan tsunami in 2004 caused child deaths that were almost 6 times higher. The number of deaths and illnesses is also caused by germs carried by water and damage to the waste disposal system. Waste and dirt flows and spreads and pollutes water sources. Children are vulnerable to diarrhea and other waterborne diseases with damaged waste disposal systems. Floods in 2013 in Cambodia caused an increase in diarrhea to epidemic levels. Likewise, there is an increase in the incidence of other diseases such as typhoid and leptospirosis. Floods also cause chemicals that have been stored to be carried into the environment. Floodwater can carry contaminants such as agricultural chemicals, pesticides, and other chemicals that can affect children. Water is very important for pregnant women as water needs increase with increasing gestational age. Lack of water intake can threaten the health of pregnant women. Low water intake can cause a lack of water in the body and even dehydration, which results in an increased risk of low birth weight and premature birth. Research by Molyani found that there was a significant influence between water adequacy and water intake on birth weight and length, as well as head and chest circumference. The difference in birth weight can reach 500 grams and the difference in body length can reach 1.4 centimeters. Drought is another impact of climate change. Drought in Bangladesh has caused the nutritional condition of children under 5 to decline. Measures of nutritional adequacy, height, weight for the child's age decrease by 0.10 to 0.11 standard deviations if the child is exposed to drought during the pregnancy period. The impact is disproportionately experienced by children from low socioeconomic backgrounds. A study in Malawi showed that exposure to drought during the second to third semester can reduce birth weight. Drought can increase the risk of diarrhea among children in low and middle-income countries. The effect was significant in 6 months of mild to severe drought and 24 months of severe drought. Hygiene, water and sanitation are issues of this condition, and the disease is higher in areas where hygiene and sanitation practices are poor. Drought also affects health indirectly through crop failure, limited water resources, food insecurity, hunger and other water-related conditions. The drought exacerbated already poor conditions in the affected areas. A UNFPA assessment of the impact of El Niño-induced drought on children, adolescents, pregnant women and breastfeeding mothers in Swaziland, Africa shows that food insecurity remains a root cause of child protection problems and remains a major cause of child prostitution and dangerous behavior among youth. The impact on girls is more severe than boys. Girls become more vulnerable to sexual abuse and exploitation. Water shortages have significantly affected girls' personal hygiene. In times of drought, children's hygiene practices usually decrease significantly. Untreated water sources can increase diarrhea and other gastrointestinal illnesses. Parents can be a source of problems for their children. Instead of protecting them in parenting, parents can and often do become perpetrators of violence against their own children. Gender-based violence has now increased and is mainly perpetrated by men.